Time of 10 o'clock having arrived, subcommittee will come to order. The chair recognizes himself for 5 minutes for an opening statement. Title 42 of the Public Health Service Act provides authority to appoint and set pay for difficult-to-fill, critical, scientific, and medical positions in the public health service. The Department of Health and Human Services uses this authority, which allows them to pay individuals above the salary limits of other government employees to attract and retain top-notch scientists and researchers who might otherwise go into academia or the private sector. Clearly, the Secretary needs some flexibility to attract and retain the best and brightest in science and medicine. But these authorities should be limited and transparent. Laws passed by Congress and regulations promulgated since the 30s and 40s show that the program was intended for special use when there was no other way to hire needed experts. It was never intended to be used as an alternative compensation program. Yet, in 2010, almost 7,000 employees at HHS were appointed using Title 42 authority, a 25% increase over 5 years. Some of those annual salaries have reached levels higher than $350,000. HHS has recently moved to lower the caps on these salaries. Yet the Secretary of HHS can still approve pay levels higher than the caps, which may give her more hiring and compensation authority than anyone else in the federal government. In 2005, the Environmental Protection Agency began hiring experts using the Title 42 authority, once again to fill critical science positions. Now, 15 of the 17 positions at the EPA are paid at or above Executive Level 4. The extensive use of Title 42 and the unprecedented authority of the Secretary to compensate some experts at extraordinarily high rates led the committee to ask the GAO to analyze the laws that govern Title 42 and audit its use at HHS and EPA. Today we have asked GAO to share the results of that study. Congressman Joe Barton has introduced H.R. 6214, the HHS Employee Compensation Reform Act of 2012, which makes simple, common-sense changes to the use of Title 42 authorities. It limits the use of Title 42 authority to HHS, caps the number of Title 42 hires to 5% of the total number of employees at HHS, ensures that compensation may not exceed 150% of Executive Level 1, allows up to 50 employees to be paid without regard to compensation limitation if the Secretary determines the position is vital, and requires a report to Congress 6 months after enactment. I commend Mr. Barton for his work on this issue, and I would like at this time to yield the remainder of my time to Dr. Burgess.
Thank you, Mr. Chairman. Title 42 is a special hiring provision that Congress explicitly gave to HHS through the Public Health Services to allow HHS to attract the best and brightest. Many of these men and women hired under Title 42 could easily be making 3 or 4 times what they make working in the public sector, but have chosen to dedicate their work to government service. Because of the salary constraints under normal Title V hiring practices, HHS's hands were tied as to what it could offer to leaders in these fields to attract them to HHS. This program began with noble purposes and continues to be an important recruitment tool for HHS, the agency that Congress intended for it to be using it. It should come as no surprise that the minute other federal agencies heard of this higher salary structure, they came to Congress asking for authority to pay themselves more. It would be one thing if these agencies had come to this committee, the authorizing committee, which wrote the Title 42 statute to begin with. Instead, the EPA did an end run around Energy and Commerce and went directly to Appropriations, asking for the authority. Every member of this committee should be shocked and outraged that an agency under our jurisdiction chose to ignore our authority as the authorizing committee for such hires. This is a congressional jurisdictional issue if there ever was one. Not only did the EPA do the end run for years, but in oversight hearing after oversight hearing, they would refuse to give us information as to their hiring practices. It's a precedent that's been set, and what's to stop every federal agency, every federal bureaucracy from doing the same thing. I introduced earlier this Congress H.R. 2791, the Health and Human Services Hiree Clarification Act, which codifies this committee's clear intent that Title 42 is only to be used by officials at HHS, not EPA, not Department of Labor, not the Park Service. I'm happy to see that Mr. Barton has included language from this legislation in his bill as well. If other agencies believe so strongly that they need a special hiring authority, come to the authorizers, justify their request, and do it as regular order dictates. This hearing is long overdue. I thank the chairman for the consideration. I'll yield back the balance of my time.
Chair thanks the gentleman and recognize the ranking member, Ms. Pallone, for 5 minutes for opening statement.
Thank you, Mr. Chairman. I wanted to ask unanimous consent to include in the record the statement of our ranking member, Henry Waxman.
Without objection, so ordered.
Today we're here to discuss a special hiring authority available to the Department of Health and Human Services, which is informally known as Title 42. The statute was created nearly 70 years ago to help the government recruit and retain the best and the brightest individuals in medicine, science, and other important fields. While we all wish it would be the case, the sense of civic duty is not always enough. This is something that I can certainly sympathize with, as I'm sure many members of Congress can too. Young people want to come and dedicate their lives to public service, but sometimes the salary of Congress simply does not compete with the private sector. And that's why the House administration created the Student Loan Repayment Program, which serves as an incentive to recruit and retain bright young professionals who work for us in Congress. But today we'll specifically hear from GAO about the recent studies that shed light on improvements that can be made to the Title 42 process. In fact, HHS even recognized the need to examine their hiring practice on their own prior to GAO, and they started an internal review back in 2010. They also currently implement a number of changes in response to this study and support its recommendations. But I just wanted to say to my colleagues, let's tread carefully during this discussion. We must not react negatively simply for politics' sake. It's good to be concerned, and it's certainly fair for this committee to maintain its oversight responsibilities, but this statute has been used by Democrats and Republicans alike, and it is critical to the quality and caliber of the work of the department. If we were to somehow restrict HHS's good work that has come about because of Title 42, we could be doing serious harm to the research in this country, both in terms of our ability to respond to public health emergencies like H1N1 and to drive towards the scientific breakthroughs like sequencing the human genome. The agencies listed in the GAO report are devoted to enhancing health, lengthening life, and reducing the burdens of illness and disability, as well as protecting all Americans from significant risks, whether these risks are from illness, the environment, or bioterrorism. NIH, as we know, is the premier biomedical research institute in the world. CDC, also an agency listed in the report, is globally renowned as the leader in disease prevention and health equity. Without dedicated funding of these agencies and top talent within their ranks, the U.S. would not be the leader in the biomedical and pharmaceutical industry, the global leader in disease prevention and public health, or a leader in the fight against devastating diseases such as cancer, obesity, and HIV. Now, using NIH as an example, NIH is a driving force behind the biomedical research that has advanced and continues to improve the health of Americans and grow the U.S. economy. Thanks in large part to NIH research, Americans are living longer, living healthier, and suffering less from morbidity and mortality of countless diseases when compared to the past. Not only has the general health of the nation been improved, but these gains have added an estimated $3.2 trillion annually to the U.S. economy since 1970. Yet it seems that we continue to ask NIH and CDC to do more with less. In the current climate, we're not doing well if the budgets for these agencies, I should say we are doing well, if the budgets for these agencies just stay the same. Our reliance on their service has grown as new public health and environmental threats emerge and the burden of disease grows. NIH employs nearly 19 1,300 civil servants in its workforce. Of those who are hired under Title 42, 44% are researchers and clinicians, and less than 2% of all NIH employees are paid above the general federal schedule. Meanwhile, the American Academy of Medical Colleges releases an annual report which describes compensation for professionals in the medical and research fields, and consider that an associate professor in radiology can make $430,000, while a department chair can make over $650,000 per year. A professor in plastic surgery can make over $650,000, and the department chief more than $800,000. So HHS's current policy caps compensation at $275,000 unless an exception is approved by the Secretary, and a recent CBO report found that federal workers with a professional degree or doctorate, which is currently a requirement for Title 42, earned about 23% less than their counterparts in the private sector. I just think it's important to keep in mind the types of people we would be affecting if we restrict Title 42. Let me mention Dr. Fauci, Director of the National Institute of Allergy and Infectious Disease at NIH. He's a recipient of the Presidential Medal of Freedom, has been fighting a battle against HIV and AIDS since the epidemic began. He's recognized around the world as one of the greatest scientific minds of our generation. In 2003, there was an Institute for Scientific Information Studies that showed that over the 20-year period from 83 to 2002, Dr. Fauci was the 13th most cited scientist among 2.5 to 3 million authors in all disciplines. And he was the 10th most cited HIV/AIDS researcher in the period 96 to 206. And he's compensated under Title 42. So I'm just pointing out that we really have to be careful what we do here. I look forward to the discussion. I welcome our witnesses. I thank the departments, for their input on this. But I do think we have to watch what we do, because I am concerned that we do not want to lose the best and the brightest. Thank you, Mr. Chairman.
Chair thanks, gentlemen, and now recognizes the Chair Emeritus of the full committee, Mr. Barton, for 5 minutes for an opening statement.
Thank you, Chairman Pitts, and I want to thank you and your staff, and Dr. Burgess and his staff, and Chairman Upton and his staff, and my staff for working so diligently on this issue. The ranking member, my good friend from New Jersey, Mr. Pallone's opening statement, I thought was very good. He didn't state it, but he said that this might be about politics. Well, it's not. We've been investigating this for 3 years. You know, it's to Chairman Upton's credit and Chairman Pitts's credit that we finally have a full hearing just on this. Unfortunately, on a day when we have a bill on the floor that a lot of our members are engaged with concerning the Solyndra. But this is an important issue. We do want the best and the brightest, as Congressman Pallone just said, those that could find revolutionary cures for some of the dreaded diseases that we've been fighting so long. We want those scientists to work for the Health and Human Services and the National Institutes of Health. That's why Congress originally passed this legislation a number of years ago, to give special hiring authority so that we could get, in those exceptional cases, the best and the brightest. The bill that I've introduced doesn't eliminate that. It still allows a large number of exemptions to hire those very special people. What's happened, though, Mr. Chairman, is that what was a well-intentioned piece of legislation 70 years ago has been used as a loophole to create an alternative pay scale. This special hiring authority that we commonly call Title 42 has become commonplace. It's almost an alternative pay scale, not just a special pay scale. Nearly 25%, 1 out of 4 of NIH employees are hired under Title 42. Mr. Pallone alluded to the director of NIH, who is an exceptional individual and is worth a lot more than we're paying him. But he's one of 6,500. You know? That's the problem. Not that we hire these extremely exceptional people under Title 42. It's that we hire thousands of people who are very competent, very qualified, but I doubt that they're all as exceptional as Dr. Foucher is. 10% of all HHS employees, 10% of all HHS employees are hired under Title 42. Believe it or not, even the Environmental Protection Agency is now using Title 42 to hire, I think, somewhere in the neighborhood of 25 people. That's just not acceptable, Mr. Chairman, in a time when we have budget deficits of over $1 trillion every year. Title 42 was not created to create an alternative pay scale. It was not created to inflate unnecessarily government salaries. Legislation, in my opinion, is needed to rein this in. H.R. 6214 is not a draconian slash-and-burn piece of legislation. It does limit the use of the provision of Title 42 to HHS. It means the EPA can't use it. I think that's common sense. It would cap the number of hires under this authority to 5%. Now, 5% is hardly, earth-shattering. That's still, at 60,000 people, 5% is 3,000 people. So that's surely, within that 3,000 person cap, we can get the best and the brightest if we need to. It would ensure that compensation under Title 42 does not exceed 150% of the Executive Level 1 pay scale under Section 5312, Title 5 of the regular government employee compensation scale. It would allow, no matter what the general pay scale is, up to 50 people at the discretion of the Secretary of HHS to be paid without regard to compensation limit, up to 50. So if we get an Albert Einstein, or if we get somebody who literally has the cure for cancer, if the Secretary wants to pay that individual, I don't know, $1 million, this piece of legislation would allow that to happen, but only up to 50 employees. The bill also would require an annual report to the Congress detailing the use of Title 42 and an enumeration of those that were receiving Title 42 compensation. So, Mr. Chairman, this is an issue that the subcommittee has been looking at for a number of years. It's an issue that I requested a GAO report on several years ago, which we're about to get the executive summary given to us. And hopefully this is a bill that on a bipartisan basis in the very near future we can move in some shape, form, or fashion. I'll say this, I know my time's expired. If there are tweaks to the bill and our minority friends want to change some of it, I'm sure I'm open to it, and I would expect that Mr. Pitts and Mr. Upton also would be. And we encourage our NIH and HHS officials to work with us to perfect this bill. And with that, I yield back.
Chair, thanks, gentlemen. Now, standing in for the ranking member of the full committee, the gentlelady from Illinois, Ms. Schakowsky, is recognized for 5 minutes.
Thank you, Mr. Chairman. In order to improve our nation's health and well-being and to stay competitive in the global marketplace, it's pretty clear to me that our government needs to recruit top talent in research and development. Title 42 has allowed us to bring in our nation's top scientists to apply their expertise to discoveries that improve health and save lives. It is vital that our federal agencies have the authority to recruit and retain vital scientific talent. The Department of Health and Human Services, and in particular NIH, has cited difficulties in recruiting and retaining top individuals in medicine, science, and other critical fields. As a result, our government has made an effort to bridge skill gaps that threaten our agency's ability to meet their missions. Even prior to this report, and I want to underscore that, even prior to this report, HHS has been diligently working on improving its Title 42 hiring process. HHS recently implemented a policy that capped annual base salaries, clarified the definition of scientific position for the purpose of Title 42 hiring, and use of a streamlined recruitment process to ensure that all other hiring authorities have been exhausted before Title 42 was used. I'm also pleased that NIH has heeded GAO's recommendations and is working to incorporate them into their Title 42 changes. While I agree that it is important in our oversight role to ensure that NIH does not abuse this authority, an ill-advised effort to statutorily cap all pay under Title 42 or to cap HHS's ability to use Title 42, such as in H.R. 6214, would have a detrimental effect on critical government research. Our nation's top scientists could make significantly more in comparable private sector jobs. When they agree to apply their skills and expertise to the public sphere, the American people benefit from their work. Congress must ensure that our government's esteemed research institutions are able to attract top talent, and to do so, Title 42 funding should not be subject to an arbitrary cap. I look forward to hearing the testimony from our witnesses concerning how HHS can build upon their work to modify its Title 42 policy, to work with my colleagues across the aisle to make sure that there are no abuses of this authority, and to ensure that the appropriate use and documentation of this important authority is available to us. And I thank you, Mr. Chairman, and I yield back.
Chair, thanks, gentlelady. All the other opening statements of the members will be made a part of the record. I'd like to introduce today's witnesses. Mr. Robert Goldenkoff is the Director of Strategic Issues for the Government Accountability Office. Welcome. Mr. Robert Kramer is the Managing Associate General Counsel, also with the Government Accountability Office. Your written statements will be made part of the record. Thank you both for being here today. And Mr. Goldenkoff, you are now recognized for 5 minutes for a summary of your testimony.
Chairman Pitts, Ranking Member Pallone, members of the subcommittee. Thank you for the opportunity to be here today to discuss Title 42, a special hiring authority used exclusively by the Department of Health and Human Services and the Environmental Protection Agency to help them overcome difficulties in recruiting and retaining individuals in medicine, science, engineering, and other fields. The two agencies use the higher salaries and other flexibilities available under Title 42 to make them more competitive in the labor market for individuals in these highly specialized fields and more agile in meeting their mission requirements. Joining me today is Robert Kramer, GAO's Managing Associate General Counsel. As requested, our remarks will focus first on the extent to which HHS and EPA have used Title 42 to appoint and set pay for employees since January 2006, and second, whether those appointments followed applicable internal controls. We were also asked to determine whether there are any statutory pay caps for individuals appointed under Title 42. Overall, HHS's use of Title 42 has increased from 5,361 positions in 2006 to 6,697 positions in 2010, an increase of around 25%. HHS officials attributed this increase in Title 42 employees to, among other factors, the agency's response to urgent public health matters. For example, HHS officials said they used Title 42 to quickly hire experts needed to develop a vaccine in response to the H1N1 flu pandemic of 2009. Nearly all of HHS's Title 42 employees work in one of three operating divisions: NIH, FDA, and the CDC. In implementing Title 42, HHS and EPA can set base pay as high as $250,000. In comparison, most federal employees are paid under the general schedule, where the highest base pay amount was $155,500 in 2010, a threshold known as Executive Level 4. That same year, more than a fifth of HHS's Title 42 employees had a base salary that exceeded that Executive Level 4. Importantly, special hiring authorities need adequate internal controls to ensure agencies use them cost-effectively. However, HHS lacks reliable data to manage and oversee its use of Title 42. As one example, because of shortcomings with its personnel database, it was difficult for HHS to provide accurate headcounts of its Title 42 employees to us and to Congress. For its part, since 2006, EPA has used Title 42 to appoint 17 employees, 15 of which earned over $155,500 in 2010. EPA appointment and compensation practices were generally consistent with its guidance. However, EPA does not have post-appointment procedures in place to ensure Title 42 employees meet ethics requirements to which they have previously agreed. In our report on which this testimony is based, we made recommendations to HHS to strengthen its oversight and management of its Title 42 authority and a recommendation to EPA to improve enforcement of its ethics requirements. HHS agreed with our recommendations while EPA disagreed, citing actions it had already taken. We acknowledged EPA's plans to address these issues, but maintain that the recommendation was needed to ensure implementation of tighter ethics provisions. I'll turn now to my colleague, Bob Kramer, who will discuss the extent to which statutory pay caps apply to certain Title 42 appointments.
Would you press your microphone, Mr. Kramer? You're recognized for 5 minutes.
Can you hear me now? I'm pleased to be here to discuss our legal opinion concerning pay caps for consultants appointed pursuant to Title 42 of the United States Code. At the outset, let me say that this was a very difficult issue. It required us to analyze laws that have been enacted over the course of many years, from 1923 to 2009. Laws we analyzed are in different pay systems, and we encountered challenges in attempting to resolve ambiguities arising from pay laws enacted at different times over those many years, nearly 90. What we did find was that a provision in a 1993 Appropriations Act established a permanent cap on the pay of individuals appointed on a limited time basis under Title 42 at all the public health agencies except 3. The cap currently limits base pay to $155.5. The permanent cap in the 1993 appropriation actually originated back in 1956 when Congress first enacted it. Congress included it again in every appropriation until 1993 each year. But in 1993, it made it permanent. Now, in 1956, when the Public Health Services regulations included time limitations on employment of all consultants, so everyone had a limited time appointment, so the appropriation cap applied to everyone. But in 1966, the regulations changed, and the time limitation was removed. But when Congress enacted the appropriation cap in 1967, and in each of the following years, it continued to apply the cap only to those consultants appointed for limited periods of time. We also examined 2 pay caps found in Title V. The first of these is Section 3109, which limits pay for temporary consultants. In 1992, Congress directed OPM to prescribe regulations to administer 3109, and OPM's regulations provide that 3109 does not apply to consultants under Title 42. Under the law, this interpretation is entitled to considerable weight, since OPM is the agency charged by Congress with administering 3109. Moreover, OPM's interpretation is consistent with actions of Congress which have signaled that 3109 does not apply to the Title 42 consultants. Since 1970, the Appropriation Acts for HHS have contained separate provisions placing identical compensation limits for consultants subject to 3109 and for Title 42 consultants appointed for limited periods of time. Obviously, identical provisions would be unnecessary if Congress believed that 3109 applied to the Title 42 folks. The other pay cap that we considered is Section 5373 of Title V. It caps pay at Level 4 of the executive schedule, currently 155.5 also. In deciding that 5373 does not apply to Title 42 consultants, we were again guided by congressional actions. For example, after 5373 was enacted, Congress enacted the permanent pay cap that I spoke of before, which limits pay for Title 42 limited time appointments to executive level 4. This provision would not have been necessary if Congress believed that the pay cap in 5373 applied, since it also limits pay to executive level 4. Additional evidence that 53-73 does not apply to Title 14 is provided by Congress's actions when it extended the authority to EPA. Our review of the legislative history at the time indicates that EPA and HHS each informed Congress during the legislative process that they did not apply the 5373 cap to the Title 42 consultants. In conclusion, if Congress wants to establish upper limits for appointments under Title 42, you may wish to consider, as indeed you are, enacting legislation to specifically enact such limits. That concludes our statements, and Mr. Goldenkoff and I would both be happy to answer any questions you may have.
Chair, thanks both of you for your opening statements. I'll begin the questioning and recognize myself 5 minutes for that purpose. Mr. Goldenkoff, the report states that according to HHS and EPA officials, the pay-setting flexibility is needed to compete with the private sector and academia pay schedules. Did you review the existing pay schedules for research scientists and consultants in the private sector or academia? Did HHS do a review of existing pay schedules? If so, what were the differences, and if not, how did they determine pay?
We did not review comparable pay in the private sector or in academia. That type of a study is extremely difficult to do. Mainly it's hard to find apples-to-apples comparisons. But having said that, HHS and EPA are in the labor market that's extremely competitive. They're competing for positions that are extremely well paid, and so it's important for them to be able to compete and hire people, as has been said here, and pay is a big incentive.
Please describe the role of the Secretary of HHS in determining pay levels outside of the civil service. Does any other federal official have that kind of authority? Does the President have that authority?
With the Secretary of HHS, my understanding is that the Secretary has the authority to approve pay above a certain cap, the highest level, but we did not look at the authorities of other department heads or agency heads.
Did you determine why the use of Title 42 increased by 25% at HHS from 2006 to 2010?
Well, we did speak to agency officials about that, and yes, it was a dramatic increase. And the reason for a key reason was, as I said, was to respond to these health emergencies. One was the H1N1 virus, where they needed to bring people on board extremely fast to develop a vaccine for it.
And what was the basis for HHS dropping the annual Title 42 salary cap from $350,000 to $250,000, which is almost a 30% decrease?
Right. That I don't.
Mr. Kramer?
Do you?
I don't know the basis upon which they decided to do it. I think it would seem like a policy judgment on their part.
Referring back to the first question, was there any language in the existing laws or regulations that describe Title 42 as a pay flexibility program needed to compete with the private sector pay schedules? Mr. Kramer?
In the legislative history when Title 42 was passed, there was, and also when EPA was granted the authority, there was discussion about the need for the Public Health Service and then EPA to be able to attract scientists to come work for them. Yes.
Where is the authority that allows HHS and EPA to operate the Title 42 in this manner?
Well, it's actually Title 42, Section 209, and we're actually speaking about subsections F, which is the consultants, and then G, which are the fellows. The scientists were brought in as to work for them for some period of time. It's those specific provisions.
Mr. Golenkoff, would you review the types of employees that were hired at HHS under Title 42 authority, such as nursing or research? And from your analysis of the laws, is there authority to hire a nurse under Title 42? And
there's broad authority there, and for example, some of the occupations that were they brought in people under Title 42. There was a staff scientist, there was a research fellow, senior investigator, clinical research nurse who specializes in the care and research participants and is responsible for assuring participant safety. So they are not necessarily caring for patients, but just caring for people who are involved in the research. The other position here, the other occupation, was a clinical fellow. So there does seem to be a lot of latitude in the positions that can be hired under Title 42.
All right, my time is expired. Recognize the ranking member, 5 minutes for questions.
Thank you, Mr. Chairman. I wanted to discuss why it's important that the HHS maintain the hiring authority granted in Title 42. I think we can all agree that it's essential for HHS to be able to recruit and retain highly trained and often specifically trained personnel in support of their mission. Because without it, people like Dr. Tony Fauci, as I mentioned, or, Dr. Howard Varmus, who's the director of National Cancer Institute, or Dr. Neil Young, the NIH hematologist we read about in Wednesday's Washington Post. He found a cure for aplastic anemia, which is a rare and fatal bone marrow disease. So in your perspective, I'm asking the two of you, in your perspective, how does Title 42 serve as an essential tool for HHS to fulfill its mission, and why is it important that the department maintain this special hiring authority? I guess either one can start. Dr. Goldenkoff, I guess.
Well, it's important for all agencies to have this flexibility, because agencies, it's about mission accomplishment, and agencies need to have the various tools that are required to compete in the labor market. And as we have already said, is that doctors and scientists and engineers, these are highly paid professions, and the GS schedule is not always sufficient to match both the salaries and other forms of compensation that are available outside of government. For example, in academia, you can have your base salary. You can also get money for publishing articles, for consulting, and those are things that are not available in the federal government. But those are things that but that is the competitive environment. And the federal government needs to have the flexibility to offer both the salary and other forms of compensation to get the best and brightest.
Mr. Kramer, would you want to respond?
Well, actually, you're asking about some policy issues, and my half of this is the legal side. Okay. So we leave the policy to you folks.
All right. Well, let me ask a second question, and that's I want to make the record clear on 2 points. First question, is it correct that HHS agreed with each of your 3 recommendations?
Yes, that is correct, and they have already started taking action on them.
Well, to the best of your knowledge, is HHS in the process of addressing each of these? And to the extent that the department hasn't done so, do you want to describe what they're doing, if you could?
Yeah, I mean, just very briefly, there were 2 key issues that we found. One had to do with the reliability of the data that was in their personnel database. And it sounds somewhat technical, but having a reliable personnel database gives you visibility over the kinds of people that you're hiring. And so it's very important for internal controls to have accurate data on your personnel. And so, for example, it was unclear how many people under these sections F or G were being hired. And as we said, that they gave us inaccurate information, they provided the Congress inaccurate information on the head counts, and it was also unclear initially, for example, it seemed as if they had hired people into components of NIH that, HHS, that was inconsistent with the Title 42 appointment authority. As it turned out, it wasn't. It was just the inaccurate data. So this data piece is an internal control issue. The other piece, the other finding where we made a recommendation was that they did not follow their internal guidelines in using Title 42 policies, for example, on making a business justification, the business case for why Title 42 was needed in the first place in terms of a particular appointment. And so based on, while we were doing our audit work, they tightened up some of their procedures. And so they are making steps in the right direction, but we felt that they haven't gone far enough. And that was the basis for one of the recommendations dealing with better documentation was needed to show that, yeah, they've basically exhausted all possibilities, and now they have to use the Title 42. And so that's an internal control or an accountability. It addresses those two issues. And then on the data, we recommended that they, when they input the information, there's a drop-down screen, and that there would be ensure that they indicate whether it's a Section F or a Section G. And again, that's the other piece of the internal control.
Thank you, Mr. Chairman. Mr. Chairman, I just wanted to clarify that this authority can only be used for doctoral level training. It's only used for that purpose.
I'm sorry?
This authority, it's only used for doctoral level training. That's my understanding.
Doctoral training?
Yeah.
Doctoral level.
I'm not familiar with
Or I'm just saying that myself. I wasn't.
G is for the fellowships, the scientists, individual scientists, and F is for the consultants, which can be
Okay.
Thank you. A variety of things.
Thanks.
Well, will the gentleman yield just to follow up on that?
Oh, sure.
What
I don't have any time, but sure.
Oh, you don't?
Oh, I guess I do. I'm sorry.
What is the justification then for hiring 347 nurses at NIH under this authority?
Well, I can try to say something about it. You know, under F, it only talks about special consultants. They don't specifically mention nurses. But in this day and age where consultants do so many things, and we don't have a specific legal definition of what we mean by consultants in 209, arguably one could say that a nurse could be brought in as a consultant. You know, I used to be an assistant U.S. attorney, and we'd pick juries, and people would be asked their occupation. They say, I'm a consultant. And so the question would be, well, what do you do? Because consultants do so many different kinds of things.
Okay, thank you. Chair recognizes the gentleman, Mr. Barton, for 5 minutes for questions.
Thank you. Before I start asking my questions, I want to make a general statement. I am not opposed or on some jihad to people who want to work in government service at HHS or NIH. You know, I'm a federal employee. My late aunt was a longtime employee of the Department of Agriculture. My sister is an EPA enforcement attorney at the regional office in EPA in Dallas. So I'm absolutely supportive of good people working in the public service area for the federal government. What I am opposed to is using a provision that was originally intended for short-time special consultants to fill specific critical needs being used as a substitute pay scale. That's what I'm opposed to. And when you have 44% of all the researchers at NIH under Title 42, and you have, I think 25% of the people at HHS under Title 42, something's out of control. Now, I'm going to ask a few questions that are trying to make that point. Mr. Goldenkopf, are there any Title 42 employees that have won a Nobel Prize?
We did not look into that.
Do you know of any?
I'm not aware of any.
Do you know of any that are potential Nobel Prize winners?
I'm not.
Were there any employees hired with the understanding that they might compete for a Nobel Prize?
No, we can't comment on.
Or whatever the equivalent prize is. You know,
I mean, it was mentioned that Dr. Fauci, I mean, obviously a Nobel Prize is only, you know, within each scientific field, you know, a handful that are selected every single year. So that's certainly the pinnacle of one's career. We do know, for example, that Dr. Fauci has won and earned a number of awards.
And nobody begrudges what he's paid. I certainly don't. I have absolutely nothing but the highest esteem for him personally and professionally. Is there any record at NIH or in HHS, or for that matter EPA, where there was a specific requirement for some unique skill set that this individual was hired and they specifically said we had to pay more because this is one of a handful of people in the country that has this skill set? Well, any indication that they even tried to do a normal job search before they used this special compensation skill?
Well, and that's what we want to see more of, and that was the basis for our recommendation, is greater accountability. Because with flexibility, that's fine, but an agency needs to have greater accountability to use something. And so, you know, we've said in some of the other work that we have done on personnel issues that pay flexibility to be able to compete in the marketplace, the labor market, for the best and the brightest, that's fine. But agencies also need to be held accountable that they're using it properly, cost effectively, consistent with applicable laws and regulations and guidance, and that there's no abuse going on. And so when we look, we pulled of the roughly 6,500 Title 42 appointments at HHS. We looked at the paperwork on about 60 of them, and we did find some gaps in that sort of documentation. That's precisely the type of thing that we were looking for, that they had exhausted all other outlets, all other avenues for getting folks that met those qualifications. And so that's what the basis or the goal of the recommendation is, to tighten that up and to see more of that. But in terms of how that translates into specific numbers, whether 6,000 is too many, you know, should it be more than 6,000? Should it be fewer than 6,000? We don't have a basis for that. But we would have a better sense, though, of knowing that if there was more robust documentation, that at least each one of those appointments met a certain threshold in terms of need and demand.
I don't want to beat a dead horse, but it's clear to me that Title 42 has been used as a substitute pay scale, and instead of doing the due diligence and trying to use the normal pay scale and find somebody competent, this has just been used as kind of a recruitment tool. We'll hire you under Title 42, and you get an extra $50,000 or $75,000, you know, and they say anybody who's being hired is going to say yes to more money instead of less. But to sit here and say that this had to be used, that it was used only in a last resort because they could not find competent people, when you increase the use of it by 25% in a 2-year period, it's being used sloppily, to say the least. And hopefully, on a bipartisan basis, we can begin to do something about it. And again, the bill that's been introduced, you know, it's not the 10 Commandments. If there's something we need to modify or change in consultation with the executive branch and the minority, I'm very open to do that, but I do hope that we tighten this up. And with that, Mr. Chairman, thank you for the hearing, and I yield back.
Chair, thanks, gentlemen. Recognize the gentlelady from Illinois, Ms. Schakowsky, for 5 minutes for questions.
Thank you, Mr. Chairman. I would like to point out, in response to the issue of Nobel Prizes, that Dr. Harold Varmus, who was the former head of the NIH, Mr. Barton, I wanted to just let you know that Dr. Harold Varmus, who was the former head of NIH, he then went to Sloan Kettering.
I understand that. That's before he worked at NIH.
Oh, I thought the question was whether or not
he didn't get hired and win this Nobel. And look, I'm for him.
No, I know you are, and I don't want to be argumentative. I just want to say we actually do proudly have someone head of the National Cancer Institute that won a Nobel Prize.
I have met that gentleman, and I am impressed with him.
Okay.
But he didn't get hired under Title 42 before he won the Nobel Prize. That's all I'm saying.
Okay. Let me also just say the enormous respect that I have for the GAO, and I've certainly found your advice and your studies so incredibly useful. And I want to focus in on one part of what the GAO found and wonder if it's not an area for bipartisan agreement. There are two sentences just in the cover sheet. One, that HHS does not have reliable data to manage and provide oversight of its use of Title 42. Seems to me that unless the steps that they've taken satisfy your requirements, and I want to ask you about that, that certainly seems like something that we ought to focus on. And two, that the EPA, and you mentioned that in your testimony, I believe, does not have post-appointment procedures in place to ensure Title 42 employees meet ethics requirements to which they have previously agreed. And that seems like a place that we all definitely ought to focus on. One, let me ask you if HHS has responded to the oversight of its use sufficiently, because I know it's made changes. And two, I wanted to ask you, in your opinion, how would caps on the use of this hiring authority, in your view, affect NIH's ability to hire the skilled workforce needed to quickly respond to public health crises? I want to just add one point. The chairman asked, do you look at the private sector? It seems to me that one of the criteria when HHS or EPA or whoever hires, I'm presuming that they do need to look at the private sector, that we're not just throwing out a number. Is there any requirement that they look at that? So let me get those answered.
Well, under the general schedule, when general schedule pay is considered and adjusted on an annual basis, it's based on salary surveys with comparable jobs in the private sector. So at least for the general schedule, now you can argue with the methodology, and a lot of people have debated that. But there is, some comparison with the private sector based on also location and level of position for GS positions. But for the Title 42 positions, I am not familiar with exactly what they do to.
Okay, but in their small time, let's talk about these management issues,
Sure.
the oversight and monitoring that I had asked you about. I mean, has NIH made any of those changes? And what about focusing on how they monitor the 40?
Yes, they agreed with the recommendation, so that's a start. They also had already taken steps to tighten up certain of their procedures in making the appointments. And what we'll be doing as part of our routine follow-up effort, with as we do with all agencies that we make recommendations to, we will continue to follow up with them to make sure that they implement those recommendations.
And what do you think the effect of caps would be?
It's difficult to say. I mean, we have not looked into that. Just in more conceptually, though, where we've looked at whether it's caps or things that are more formulaic in other areas, sometimes it doesn't always get the result that you want and does affect mission accomplishment. In this specific case, though, we can't say. And we have not looked into it. But it is, I would say, it's something to be sensitive to, because really what this is about, as we said earlier, it's about mission accomplishment. And whether the number should be 5%, whether it should be 2%, whether it should be 10%, it's really hard to say. Yeah. And so is that number, what's the basis for that number? And this is why we keep coming back to the internal controls and the accountability. So, so long as that there is a justification for each one of those appointments, and this is where, for example, the annual reporting requirement in the new legislation would probably be a good thing, because it could force HHS to
that's what I was thinking too,
Mr.
Barton, that the annual reporting requirement is something I think all of us certainly could easily agree with and should. Thank you. I yield back.
Chair thanks, gentlelady. Now recognize Dr. Burgess for 5 minutes for questions.
Thank you, Mr. Chairman, and Mr. Goldenkoff. I think that's exactly the point. This whole process needs to be tightened up, and while we all want to see programs have flexibility to get the people in to do the work that needs to be done when it needs to be done, at the same time, if there is no oversight, I think we get the general impression that this is a program that hasn't been under tight control, and many things may have gotten away from not just HHS but other agencies as well. The chairman asked a good question about comparable salaries, and then I think Ms. Schakowsky followed up on that. You mentioned salary surveys. Would that also include salary history of the individual under consideration?
We did not. It was outside the scope of the study that we did.
But wouldn't that be a reasonable thing to include?
Oh, yes, yes, most definitely.
You know, I don't want to belabor the point, but the limited data I have available to me, which is the wiki org chart, the top salary earner on that, and it's an individual named after a subatomic particle who earns $350,000 a year. And I'm sure he does a great job. I'm sure his position is important, and the country is the better for having him there. He's the head of the endocrine oncology section surgery branch at the National Cancer Institute. Tough job. We want him to do it, but his previous position that apparently earned $256,000 in 2008. So that's a pretty big jump from almost a $100,000 jump in salary. Now, again, I'm not saying this individual's not worth it, but I would hope that somebody has got their hand on the tiller and who's making these decisions. Let me ask you this. Any big company is going to have an HR department director who kind of oversees this stuff. Is there the equivalent of an HR director at HHS?
Well, there's a chief human capital officer.
Okay, who is that individual?
Off the top of my head, I don't know.
Okay, maybe you could provide that information to us.
Sure.
And Mr. Chairman, that might be something we want to follow up on when we do our written questions. It's just been said so many ways that we want the people there to do the work that needs to be done when it needs to be done. Now, you've referenced the H1N1 crisis, and that was a crisis. But it's odd that we think that required a sudden increase in Title 42 hires at higher salaries because, the stimulus bill passed not 2.5 months before that with an extra $10 billion to NIH. I mean, so they had cash, they had money in the coffers. Interesting to see how that was allocated. And then, of course, the other thing is we'd also, less than 10 years before, come through 9/11 with all the beefing up of national labs and building the infrastructure. So I might understand from your line of reasoning that the NIH and these other national labs do not have the surge capacity to deal with an existential threat like H1N1?
Again, we have not looked at that. It was outside. We looked at something that was just very, very narrow, and that was Title 42.
Yeah, and I appreciate that, but again, at the same time, it is like we spent all this money on readiness, and then we spent all the money in the stimulus. Surely we weren't having to then go out and shop for the best and brightest minds in the business in order to bring them in to do this work. Mr. Kramer, let me ask you a question on the National Cancer Act of 1971 made the positions of the director of NIH and the director of the National Cancer Institute into presidential appointments. Since they are presidential appointments, they were no longer secretarial appointments under Title 42. Does that mean the NIH director and the NCI director are not eligible for Title 42 salaries?
I'm not in a position to answer that specific question now because I haven't considered it before. So I can look into it and get back to you on it. I don't know.
Do you know the salary of Dr. Collins?
No, I don't.
Yeah, I don't either. Is there anybody that earns more than Dr. Collins at the NIH?
I didn't look into the salary issues of people I was.
Mr. Goldenkoff, do you have that information?
We have data on salaries, but we did not have it by specific individuals. We have, the data was provided to us. Right, we just have IDs, but we cannot link a particular salary level with a specific individual.
Oh, go to Wiki org chart; they'll do it for you. But just interesting if there are individuals at NIH that earn more than the director, and how many individuals there are that earn this, and perhaps a quick glance at the services that they provide where they would earn a salary in excess of the director of the entire NIH.
Yeah,
And we'll submit that as a question for writing, one of the questions to respond in written form. I don't expect an answer.
We can provide that to you.
Right.
Yeah.
Very well. Thank you, Chairman. I'll yield back the balance of my time.
Chair, thanks, gentlemen. Recognize General from Illinois, Mr. Shimkus, for 5 minutes for a question.
Thank you, Chairman. I do appreciate you all for coming. I do agree. I find the help of the GAO very helpful to us as public policy folks. So, but in just listening to your opening statements and testimonies, and Mr. Kramer, for you to go back to 26 and then figure out what happened in 56 and try to weave this path of how we got to where we're at and why, just that analysis says we need to clean this up. You know, and over the years of, so I mean, just the opening statement saying we're cobbling this together to figure out how we got here, where what Mr. Barton would do is to say, let's just take a look at it, write an authorization, get bipartisan support, clean it up, try to get reliable data on the use of his Title 42 authority, as you state in your report. So I'm excited. I think this is much needed. And let me ask, I guess, a question. The Public Health Act, and this is Title 42 of that big law. EPA doesn't come under that authority under the Public Health Act, correct?
That's right. It's a
so the EPA got drug into this through an appropriation bill. Is that right?
Yes. Well, it was a bill that authorized the EPA to make use of Title 42 authorities.
And I understand that was under an appropriation bill that
yes.
then became law.
Right,
and
that's right, it was.
So we as authorizers also really dislike public policy created through spending authority versus authorization. So the other aspect would be, let's have this debate of whether EPA should be under this. Let's go through the authorization process and have that debate. Should this apply to versus let's let these sneaky appropriators do it through their process, right? I mean, so that's another aspect. We should not be afraid of this debate. And again, even on both sides, and even my friend from Illinois, she has identified some things I think we definitely can try to clean up, and I wouldn't think would be that difficult. Now, I have my question also. It comes from the report to try to explain one of the footnotes here on page 2 of your report, and I'll just read it to make it easy. It says the salary and compensation limits were lowered by HHS policy issued in February 2012 and March 2007. HHS limited annual base salary employees hired under Section 209F to $350,000 and $375,000 in total compensation. These higher limits were in place during most years of our review of HHS's Title 42 use. Total compensation at HHS includes base pay, recruitment, retention, et cetera, et cetera, et cetera. That is trying to make a statement that the administration itself said, this thing's got overinflated. And I just go to Mr. Goldenkoff. Is that how I'm reading it? These things got overinflated, and they are pulling it back. In the main section of that page, which is page 2, you have annual base salary for many appointees under Title 42 HS cannot exceed $250,000. That was by policy from the administrative staff. Is that correct?
I believe so, yes, that's correct.
And so without proper going back to one of your main statements about there's no really market analysis of why we paid this, even the administration said, these things got overinflated. We're gonna pull them back, which I think goes to some of the questions about what positions are being used, how we evaluate in that salary range, and I concur with Mr. Barton to some extent that there seems like there's a different salary range outside of the normal process, and it's just grown over time as things do here. Again, I appreciate the testimony. It's a great hearing. Mr. Chairman, thank you very much, and thank you for your great work.
Chair thanks the gentleman, and now recognize the gentleman from Georgia, Dr. Gingrey, for 5 minutes for questions.
Well, I thank you, Mr. Chairman, for recognizing me. I came in at the very tail end of this, and doggone it, Mr. Shimkus, as he always does, took my question, the last question on my list, but he did it better than I could. Let me just make a comment and say that I thank the witnesses from GAO for testifying this morning, and I would concur with my colleague from Illinois that we are deeply appreciative of the work that you do, not just on this, but in general. It's very, very helpful, as is CRS, to help us do our work and do a better job. Maybe rather than me asking a question that's already been asked, the two of you could sort of summarize, if you have not already done that, if you don't mind, maybe in a condensed manner, do that for me in regard to what you have found in this report and what your recommendations are going forward, both for HHS and EPA in regard to this issue.
Sure, there were two. I mean, in a nutshell, it was, we recognize the importance of having pay flexibility, but, we're GAO. Our middle name is literally accountability. So what we also were looking for was more accountability in their use of Title 42, because we're in agreement with that. We don't want abuse of it. We don't want any waste. We don't want there to be indiscriminate use of Title 42. And so when we went to look at we looked at the extent to which the Title 42 appointments at both HHS and EPA were consistent with the law, applicable regulations, agency policies, and what we found was that within HHS, there were issues in terms of their ability to even oversee their use of Title 42, and that's that data issue. They really didn't have a good accounting of who was Title 42F or Title 42G. There was just some sloppiness in there, and actually we spent a fair amount of time of the audit was spent working with HHS, just cleaning up their database. And so that was what led to one of the recommendations to HHS. The second finding on HHS concerned their documentation, their justification for needing Title 42, and we found that in some cases they weren't always consistent with their own policies. And so that led to our other recommendation to HHS dealing with the need to tighten up and better document the need for the authority. And then for EPA, obviously they have far fewer Title 42 appointments. So what we did find there is that those 17 appointments were consistent with their policies, but we found that there were some issues with conflict of interest provisions, and they didn't always follow up with employees that did things that were basically, they had stock holdings, and they did not divest in them as they were asked.
Well, I'll just interrupt you and just say this. I think that was a very, very important finding, that conflict of interest issue, particularly in regard to EPA and all these rules and regulations that get handed down. So thank you for that work. Mr. Kramer, did you have any comments that you want to add?
We looked essentially at this question of pay caps and whether we looked at this question of pay caps and whether or not any of the pay caps that we considered that exist in the federal compensation systems, there's a number of different systems, actually applied to the Title 42 folks, and we found that there was a very limited there is a very limited cap on the pay of only those who work for a limited time basis. To sum it up, the statutory schemes are very complicated, and if the committee can begin to work on trying to harmonize the various things that have happened over the many years during which all of these laws have been passed, to bring it together and to make it simpler, it would be a great service to HHS and to the federal government.
Would you yield to Dr. Burgess, please? we're going to have one follow-up. Yeah, go ahead and finish.
I was just going to ask Mr. Goldenkoff about the how does the HHS implementation of Title 42 differ or compare to EPA's implementation of Title 42?
Compared to what?
The HHS and EPA, do they when they're governed under Title 42?
Yes.
Is their approach identical, or are there differences between the two agencies?
It seems that EPA's practices were a little bit tighter, a little bit more thorough, and certainly they were more consistent in following. Now, granted, there were also fewer cases to look at. So, we were dealing with over, 6,000 cases versus the 10 that we looked at in EPA, I believe. So just the likelihood was we were going to find more.
So how many Title 42 employees are there at EPA?
He's going to.
I'm sorry?
How many Title 42 employees are there at EPA?
17.
And how many could they hire?
Up to 30.
Do they need those slots if they're unfilled?
My understanding is there are plans to fill them.
Yeah, I'd say don't.
And again, this is a policy issue. It's an internal management matter that we did not look into, and
we will.
Can't second guess that.
Thank you. I yield back.
Per side, Mr. Barton for 5 minutes.
Thank you, Mr. Chairman. I'm not sure I'll take the 5 minutes. Under current law or current regulations, is there a limit on what the Secretary of HHS can pay an exceptional individual?
There is a limit in the appropriation law if that person is a person who's appointed for a limited period of time.
What if they're not appointed for a limited period?
No, there is no limit.
There is no, so
there is no limit.
Theoretically, under current law and regulation, the Secretary of HHS could pay somebody $2 million a year. They don't do it, I understand that, but there's no limit on it right now.
There is no law that would prohibit that at this time.
This time, thank you. Should there be a law that puts a specific cap on compensation?
If Congress decides there should be a law, there should be a law.
That's a great answer. Can't beat that. Is under my understanding is that Title 42 originally was established during World War II for temporary special consultants. Is that correct?
Yes. Back in 1944, Title 42 was enacted into law. And at that time, although the law itself did not specify that the employees had to be temporary, the regulations of the Public Health Service, which went into effect in 46 actually, limited them in time. But it's an interesting little twist here. It didn't limit them to, say, a year or 2 years or 3 years. What it provided was that consultants hired and fellows hired under Title 42 could only be employed for up to 1/2 the working days in any year.
Under 1/2.
So although they could have been there for many years, they could only work essentially half time.
When did the word temporary, or maybe I should, of the people that have been hired most recently under Title 42, are they classified as temporary or are they classified as full-time permanent?
I can't speak to how HHS treats them on their books. I don't know if Mr. Goldenkoff.
Term appointments? Okay.
Are when they're
or indefinite?
They're what?
I understand it's either term or indefinite.
Indefinite. So they're hired. If I'm hired under the general scale at HHS, GS something, whatever, I'm hired as a permanent full-time employee,
That is
correct?
correct.
But if I'm hired under Title 42, I'm considered an indefinite. And indefinite could be 30 years.
But we did not see that going on. I mean, we did look at that, just precisely that, and we did not see that in the data that we looked at.
Well, should a reform be that we either define what temporary is and put some specificity to it and require that Title 42 only be used for truly temporary special needs, or should we go the other way and say, let's end this hypocrisy of indefiniteness, and say that they're going to be full-time? In other words, let's be transparent about it.
To the extent, and I think this is one of the other flexibilities that we haven't discussed yet, is that Title 42, the fact that these are term appointments, does allow for bringing people in for a limited period of time, and that could align with a particular research project. And so, in theory, when that research project is over, then, you know,
but that's apparently not how they're doing it. They don't sign a contract for a research project. They just hired as regular employees, and they get all the benefits, but it's for an indefinite period of time.
But then compared to, say, a permanent employee who is there for, you know, the next 30 years.
Hopefully.
So that flexibility is important. But, you know, you are correct, and and again, it's part of having this oversight that folks aren't there for an indefinite period of time, and they are not re-upped on a regular basis.
My time's about to expire, and I appreciate the chairman letting me have a second round. Should we legislatively define this program and put some definitions and caps in it, or should it be left to the executive branch to handle it on an executive regulatory basis?
We would need to consider that more, you know, the implications of caps in particular and how that would affect the overall flexibility. And, you know, certainly, you know, there's the need to ensure that agency, that HHS and EPA don't use this indiscriminately or as an alternate to standard hiring procedures. But would a cap be too blunt of an instrument? And is the way to get around that is through maybe tighter internal controls to ensure that for every appointment that is made, that they had exhausted all other mechanisms.
My time has expired, but I just know when I was in the private sector and had to make hiring decisions, if I really needed a position hired, and that was always the exceptional case that I had to have that. I mean, I would go to my boss if it was above my ability to pay them what I thought they needed and say, I've got to have this individual, and we need to pay him 125% of the market. I never said, well, I really need him, but I just want to pay him 75%. I mean, if you leave it to the discretion at the executive level, they're always going to say we have to have that person and we need to pay him more. With that, I yield back.
Chair thanks the gentleman, and now recognize the ranking member for 5 minutes.
Thank you, Mr. Chairman. Gentlemen, I just wanted to make it clear and basically commend the department, HHS, for the actions it's already taken to respond to your recommendations. I want to make it clear that they have. And if I could ask unanimous consent, Mr. Chairman, to enter into the record the HHS Human Resources Manual that's been updated, or the section that's been updated in February 2012.
Without objection, so ordered.
And specifically because I did mention before about this this policy only applying to doctoral candidates, and I knew you had mentioned the nurses, or it had come up about the nurses. And part of the manual change that says that underqualifications requires that appointees have a doctoral level degree in a scientific discipline related to the position and professional stature that is commensurate with the duties of the position being filled. Prior HH policy only required a bachelor's degree, so it was in fact the case that before you could just have a bachelor's degree, which is, I assume, a reference to the nurses, but it's not true under the revisions that they've made that we've now entered into the record. And the other thing I wanted to point out is that, and again, this is my effort to try to make it clear that this is not or should not be partisan, that the EPA was added to this program in 2005, and that was under a Republican president and a Republican majority in the Congress. So it's not that this is something that has just existed under the Democrats. It's existed under both administrations, and in the case of HHS, they're clearly trying to rectify some of the problems pursuant to your recommendations. That's all, Mr. Chairman. I yield back.
All right, thank you. And that concludes the questioning from our members. Your report has raised a lot of questions. I'm sure members will have additional follow-up questions that they will submit in writing. I ask the members, or remind them, they'll have 10 business days to submit questions for the record, and I ask the witnesses to respond to the questions promptly. Members should submit their questions by the close of business on Friday, September the 28th. And without objection, the subcommittee is adjourned.